Good morning, everyone. Welcome. Thanks so much for joining us for today's training on Knock Out Opioid Abuse Day. Knock Out Opioid Abuse Day is going to be held once again on October 6th. It's a Friday this year, so we're excited to get as much participation and outreach as we can on that day. And that's what today's training is about, to talk to you about what the day is about, why it's so important that all of us take a role in sharing information and education and prevention and reducing stigma. And that's all what Knock Out Opioid Abuse Day is about. And then we're going to talk to you a little bit about some success stories, some resources that are available. And I hope that everyone can see one way that they can help knock out opioid abuse on October 6th this year. So I'm so pleased to have with us our expert panelists who are going to talk to us today. And I'm so glad that they're with us. And I'm so glad that you're all with us because, we continue to talk about the opioid crisis. And we know in New Jersey that we're kind of holding steady in our overdose rates. But you know what? This crisis is continuing to manifest itself in so many different ways, as we're hearing about fentanyl and xylazine in all different ways. And so that's why I'm so happy that we have our panelists here to talk to us today about what they've done, what they know, and what they've experienced, and how they've made Knockout Day a success. So our first speaker is Matt Birchnow. He is our Director of Community Events at the Partnership for a Drug Free New Jersey. Welcome, Matt. We have Rebecca Alfaro. She is the Deputy Executive Director of the Governor's Council on Alcoholism and Drug Abuse. Welcome, Rebecca. And we have Barbara Kaufman, the Director of Prevention Services for Morris County Prevention is Key, and Patrice Riley, the Manager of Prevention Services for Morris County Prevention is Key. And we're so happy, Barb and Patrice, that you're joining us. And just some history, this project started as a collaboration between the three organizations who are represented today: the Partnership for a Drug Free New Jersey, the Governor's Council on Alcoholism and Drug Abuse, and Morris County Prevention is Key. And it really came from an idea that was discussed at a Morris County Prevention is Key meeting back 8 years ago. So really happy to all still continue to be working together, and for all of us to share our expertise. But again, I thank you all for being with us. Looking forward to question and answer time so we can see different ways that within your own specialty or organization that you can be involved. So without anything further, I will turn the presentation over to you, Matt. Welcome.
Great. Thank you, Angela. Really appreciate that. And thanks everybody who was able to join us today and be a part of this. And we really welcome those of you who have not participated in Knock Out Opioid Abuse Day before, and this might be your first time. So I'm really happy to have you aboard. And then for those of you who are veterans of this, thank you for your work in the past several years. And for continuing to be a part of this effort this year as we go forward. So just want to touch on a few things today. Three main topics that I'll get to, and then I'll yield to Rebecca and Barb and Patrice. But I just want to touch a little bit more about the history of Knock Out Opioid Abuse Day. I know Angela gave a good bit of information on that already. And then some of the resources that we provide to help you in your outreach within your communities and beyond through our website and things like that. And then just a little bit into some ideas on some groups or organizations or just general, groups within the community that you can outreach to help really amplify the work we're trying to do and educate residents and people within the community further on the opioid epidemic. So just a little bit about the history and what Knock Out Opioid Abuse Day is. As Angela mentioned, this was an idea about 7-8 years ago that got its start. The first one was in 2016. So this year is actually our 8th annual Knock Out Opioid Abuse Day, which the first year the state legislature passed a joint resolution designating October 6th as a day of education on the opioid epidemic, and for residents throughout the state to help spread the message and information on the risks of prescription opioids, the link to heroin use, and in more recent years, especially emphasizing fentanyl and other new topics as the opioid crisis has continued to really plague New Jersey and beyond. So it was signed by Governor Christie at the time, and in subsequent years, Governor Murphy has also signed off on October 6th being that day, that single day of prevention, information, and awareness being spread. Obviously, the first few years, it was a lot of door-to-door, delivering the very well-known door hangers that we've made and printed in the first several years. Events at community events, setting up tables, getting the word out that way. Other sorts of events tying in opioid awareness with those community events to really just spread the message in a number of ways. Obviously, in 2020, the pandemic really made us have to go a different approach. And so those next couple of years were really virtual, heavy on virtual type spreading of information through social media, through emails, things like that. And really had to go that route just for everyone's safety. But it provided a lot of new opportunities in spreading the word, getting new people involved, getting leaders in government, law enforcement, medical profession on board and spreading it that way. Last year with the pandemic lifting a little bit, we were able to have more of a hybrid type approach where some people did have went back to an in-person approach a little bit as well. So it's morphed as we've needed to adjust over the years, and we've had to adapt. But the most important thing is really getting that information out to the community, to healthcare professionals who, we want to make sure that they're up to date on new standards for prescribing. We want to make sure communities know about this issue in general. Sometimes I think a lot of people involved are so immersed in it that you don't know there are still a lot of people that don't really know what this is quite all about, what the dangers are, what the risks are. So that's what the goal is, just to reach everyday people in New Jersey and, leaders within the community to help spread the word. So that's what we're continuing to do this year. And we'll be doing that, and I'll show you a little bit in how you can do that over the next few slides. So when we talk about outreach, at this point, I think the real key to getting ideas of what you can do and how you can really spread the word is to go to our website, which is right here. And we have a few screenshots. This middle one right here is what it's the homepage, and it gives you a lot of ideas, as from simple to a little more effort or more hands needed to just spread the word, and part of that is also educating yourself a little better on what's going on and certain trends in the opioid epidemic. So we like to provide just that information. Then you'll see sort of the top tabs up there with resources, and those come in a variety of ways. When we're talking about virtual or social media resources, you'll see on the right there, we have a lot of images from campaigns that we've run, which are, you can download those, you can use those on your social media account, you can send them in an email, whether as part of an organization to your contact lists. You can send them out that way, or just as an individual, to friends or people in your community who you want to make more aware of what's going on and make sure that they're educated so that they can, do something in their own right to help solve this crisis. And then we have other resources there on the left, which is these are just a sampling. So I would recommend everybody go to the website on their own, kind of see what's there. See if you have any ideas of things you might want to, add. We might have them that they're just not up there yet. We'll be updating this throughout the next couple months leading up to October 6th. But we do have the press kit as well, because regardless of whether it's been heavily in person or virtual, the press is and media, they're really it's really an important way to amplify that message and get it out further. So we do have sample press releases for if you are having an event, we can you can put out a media advisory and try to get media to attend and cover it. Or after the event, same thing. So we have sort of a template there that you can fill in the blanks or add what you'd like, but just to give you an idea of what you can do. We have a sample letter to the editor that number of people over the years have sent to their publications to, again, just get the word out in the opinion section so people know what the newest the newest information on what's going on. And it's just another way, another tool to do that. We have letters that you can send out to different groups. For example, one second you can send out to prescribers so that they're aware. If you want to get more people in your community involved and sharing and spreading information, we have sample letters to send to your athletic directors at high schools who could possibly host something at sporting events, to scouts, to faith leaders, all coalitions that can really help spread and are often looking to get involved in programs like that. So that, like I would say, just go to the website and you'll see there's a tab about webinars there, which is our learning series, which you're probably well aware of if you're on this webinar, but I'll get into that a little bit later. So I'd like to just go into some of the groups, and some of these are really blatantly simple as far as people you can outreach to, and I think this one falls in that category where we have just reaching out to your neighbors and within your community. And that involves, again, just putting a social media post up, sending out emails. In some instances, we still do have physical materials that if you would like, we have limited supply, but if you'd like them, as you can see in the pictures there, where people went in the community and shared these messages, to people, commuters and people going in shopping, going to supermarkets, things like that. So that's really a great place to start. Just, everyday life, sharing these messages with people you come in contact with. That's really kind of simple, bare bones as it gets, but also extremely effective when you reach someone. Government has been something where we've had many, successful efforts over the years. And as you can see, this kind of spans the virtual era that I mentioned, as well as the in-person era of the first few years. But I would recommend if you have people in municipal government, county, or anything like that, state even, that you're in contact with, just send them an email or give them a call and say, hey, this is going on October 6th. Can you share a message on social media? Can you send an email to your constituents? Or even somebody you haven't been in contact with. I think it's still worth it. Worth giving it a try. And we get a lot of people that want to be a part of this in simple ways. So you'll see the social media posts there that have been shared over the years. Down in that bottom left picture, that's actually a sample resolution that we have created a template for, that people have brought to their municipal governments or even county in some cases, and they've passed a resolution saying October 6th in this jurisdiction is Knock Out Opioid Abuse Day as well. It's really a small kind of gesture, but I think it gets the issue to top of mind of the people who can make more decisions regarding this epidemic, and really kind of get it on their radar, as well as the people in their communities, their constituents. Schools and youth, always a good one. As you can see over the years, we've had students within the schools put the door hangers. They brought it out within their communities, even beyond the school. Last year, we had a great collaboration with the Super Football Conference, who actually had most of their schools set up tables at their football games on Friday night, Saturday afternoons, and put out tables with information so that all the fans, all the parents who were there were exposed to that and could learn more about this. And obviously, student athletes, in many cases, suffer injuries. There's some people who will come up, very, it'll be very relevant to them if they have injuries, need surgery, potentially, or prescribed opioids. So that's a group that's also important to single out. As you can see on that football helmet there, we've had helmet stickers that some teams have worn. We do have those available. If you would like any, you can just contact us and we'll try to get some to you. And then local businesses is one that has always been great over the years where we've had it, but we had a concerted effort last year by the Ocean County Prosecutor's Office, specifically just to name, one group who they reached out to their businesses with the door hangers and other information. They shared it with their customers as they came in, put them on pizza boxes, as you can see, the dry cleaning there, the takeout orders, just as a small reminder or just a initial outreach of information to people that might not know, again, like I said, might not know exactly what's going on with the opioid crisis. So that's been always effective. And, recent years too, it's just been reinforced as ways to get information out into the community. So those were some groups to outreach to. As I mentioned, we do have the learning series, which this webinar is technically a part of. It's a little bit different than some of the webinars we've had leading up to this point, but it's a year-round. It's basically a year-round application of Knockout Opioid Abuse Day that we've tried to educate people throughout the year and go beyond October 6th. So on October 6th, we will actually have a webinar that's down here with an update from NIDA, from Deputy Director Wilson Compton, who's going to be really a great speaker and so knowledgeable on the issue. We'd like you to join that if you can. This will actually be approved for continuing education credit for a number of groups. When we send out the email blast before October 6th, you'll see which nurses, doctors, dentists, nurse practitioners, and the like. But we'll have that, that continuing education credit as just another incentive to attend. But we have these monthly. September, we'll have one on recovery. So it's just another way, if somebody's interested in learning more about what's going on, it's a great avenue to do that. The past webinars are on the website as well. So just a great opportunity to review some topics if there are some that really stand out to you and you'd like to learn more about. But I would definitely recommend joining Friday, October 6th, the webinar at 11 a.m. And would like to encourage you to attend as many of these webinars as you can for all the information that we've provided. So I'll cut off here, hand it back to Angela. But if you have any questions, I'll be on, of course, at the end. And again, thank you for being part of the webinar today.
Thanks, Matt. Thanks for that comprehensive overview. We look back to see how far we've come since the very beginning, and all the different ways that people have shared messages and then have had some great ideas. And I see some of our attendees are some really long time participants. I think you might have seen some older photos in there that have been sent in. So glad to see familiar faces as well as new names and faces join us today. Now I'm going to turn the presentation over to Rebecca Alfaro. Rebecca, welcome. Thanks for being with us.
Thank you, Angela. And I'm going to speak to you a bit more about the value of prevention and how our Municipal Alliance program can continue to be involved in this. I first want to thank the partnership and Barb Kaufman because it was the three of us that came together to have this discussion so many years ago, and to see this event turn into a national day, or I'm sorry, a statewide day, and just continue to take off and grow each year has just been an absolute privilege to be involved in this. So once again, thank you. Next slide, Matt, please. Thank you. So when we talk about the value of prevention, why do we do what we do? What is it? How is it helping our communities? What are our efforts going towards? And I think we have to look at, when we sell prevention in a sense of having to see the value here, a lot of times that hits people right in the pocket, right? So looking at the cost benefit of prevention is always so important, because for every dollar that we spend in prevention can result in $10 in long-term savings over time. So next slide. And the way that manifests too is that when we look in investing, it's also the intangible benefits. So we're looking at the overall reduction in crime rates, looking at increase in productivity, looking at decrease in motor vehicle accidents, and overall life expectancy going up, and of course, higher employment rates. So we look at what we're doing, we know that we're not only influencing our community to be healthy and safe, but we're also looking at these intangible benefits that continue to carry forward with our value. So next slide, Matt. In doing that, we know that our environmental strategies, so when we have the ability to change community-wide laws, prevention, and prevention, laws, policies, and practices, then for every dollar we spend on environmental strategies, and when they're implemented nationally, so I'm taking you a little bit further, a little bit more global in our conversation today, but when we see that widespread attention, we are saving actually more. We're saving up to $63 in and depending on the intervention. So that cost savings up to $63 lends even further. So what this really does is it supports the idea that our efforts that are taking place more widespread. So we're spanning not only our communities, but we're spanning our counties, we're spanning the whole state, that we really have that global impact. So we're able to really achieve a better cost benefit ratio in the long term. So again, like as you are informing the public of these issues about opioid misuse and the need for harm reduction, you're really contributing to that greater capacity in New Jersey to have a much further influence in our reach. So next slide, Matt. I think that was our Municipal Alliance program. So that leads me to where we are now with our Municipal Alliance program. So we have 320 municipal alliances that cover 419 municipalities. So we are so perfectly suited to be able to carry forward these prevention messages within our communities. And it really lends itself to how we're able to create that sphere of influence and widen the scope of who we're able to reach within our communities. So the alliances already have these relationships established throughout the community. So you are all the perfect people to continue to spread this message. And on a day when we're all doing it together has such a greater impact. So I just want to say that there has been such success with this, particularly with our alliances across the state. Salem County in particular has done a tremendous job in really spanning all sectors of the community that Matt was talking about earlier. So they've been involved with reaching out to apartment complexes, putting door hangers there. They've gone to doctor's office, dentists, local businesses. They've been very involved with the schools. So the more sectors that are involved and the more wider we can reach our community, the greater impact we are going to have. So as Alliance members, I encourage you to go ahead and, continue to build your capacity, continue to establish those relationships that are really going to carry this message forward. And once again, I just really want to thank the partnership. I'm excited to see what this year brings. Each year we've gotten bigger and better with this event. And so I'm really looking forward to seeing what takes place on October 6th and forward. So once again, thank you all so much.
Thanks, Rebecca. Appreciate you giving us that overview on prevention. I know it's something that, can be so confusing to so many of us, even if those of us who are in the work. So it's good to see that kind of financial tie to it. So thanks for that. Next, I'm going to turn the presentation over to Barb and Patrice. Barb and Patrice, welcome.
Hi, thank you. And thank you again to Rebecca, because you are really letting people know the importance of all we do in prevention. So thank you. I want to introduce myself. My name is Barb Kaufman, Director of Prevention Services for Prevention is Key. Have worked with many of you, I'm sure, especially those in the alliances who have helped us. I had always said that the alliances were the feet to all of our activities. So thanks again, especially with Knock Out Opioid Abuse Day. And I want to introduce our manager.
Good morning, everyone. Patrice Riley, Manager of Prevention Services here at Prevention is Key. And just to give you a quick overview of what Prevention is Key, what we offer. For over 30 years, Prevention is Key has been dedicated to the promotion of health and well-being of our community. So we're the prevention hub in Morris County. We provide prevention services through education, advocacy, just heighten awareness. Obviously, Knock Out Opioid Abuse is a huge one that we incorporate in almost all of our events. We talk about it with our family programs and everywhere we go, with all of our, every event we host. Also, 8 years ago, not only did Knock Out Opioid Abuse Day start, but we also opened our Center for Addiction Recovery, Education, and Success. And it is a place where people can go, and we honor all multiple paths of recovery. And it's nice to have some people could just drop in, and we're there to help any way we can.
Thanks, Patrice. Next slide, Matt, please. I had to include this. Opioids don't just destroy the lives of those who use them, but destroy the lives of everyone in their orbit. I had heard this as part of a Netflix series that's on now, it's called Painkiller. I wanted to include him because it really makes us realize the importance of the work that we're doing. Certainly with Knock Out Opioid Abuse Day, we had, as Rebecca and Angela had said, we sat together and talked about this some 8 years ago. Really, it had started, and I'm sure Angela remembers, part of my work is to coordinate a regional coalition, Community Coalition for a Safe and Healthy Mars. So Angela and Angelo were at this meeting where I was just very informally saying to all my friends, we got to start knocking on doors. We have really got to let people know the tragedy of opioid use. And of course, Angela and Angelo took it to tremendous lengths and started Knock Out Opioid Abuse Day with the help of the Governor's Council, of course. So that's how it began. And it has certainly moved way past knocking on doors. Next slide, please, Matt. So why do we do this? Why do we continue to do this? It is the 8th year, which is incredible to me. And I know that, as Angela said, we've made some strides. People are now more aware of and educated about the consequences of opioid use. But it's still happening. These statistics that I took, the first from National Health Institute, 71,000 Americans died from overdose tied to synthetic opioids in 2021. And again, in 2021, the number of reported deaths involving prescription opioids totaled almost, 17,000 people. So there's still a lot of work to be done, and we will continue to do it. Next slide, please. So what can we do? Biggest thing, community outreach, which is what Knock Out Opioid Abuse Day is. It has evolved from more than, leaving the door hangers on the doors, which, wow, those first couple of years, we covered all of Morris County. We are involved with partnership, of course, with prescriber education, the town hall series that we had done. And I know, Angela, you'll probably talk about this more, the curriculum that you have developed, or partnership has developed for prescribers that will hit the ground, I think, in the fall. I'm so proud to at least help out with that. We are meeting the mandate, the New Jersey mandate that prescribers have got to have credits in understanding opioids and prescribing, safe prescribing. Parent education is really a lot of what Patrice does. Patrice, you want to talk about that?
For all of our parent education programs that we do through our Hidden in Plain Sight, even our Strengthening Families programs, our back to school nights we go to, we always bring up, it's a big conversation about opioids and the misuse and stuff, what's going on. So we talk about that with all of them. Even our older adults, they're really intrigued and really want to know the knowledge of how they can help, what they can do. We're handing out NARC kits in most of our programs. So it's really great. It's great to have it out there. It's just to have the knowledge. And some of our older adults, even they were retired doctors and dentists, and they asked for the prescriber education packets because they did not know it back then. So it really is nice, again, just getting it out there and canvassing our community and everyone to know what's going on and how we can help and how we can just have the open conversation about it.
Thanks, Patrice. And the multimedia campaign, which involves community awareness. Matt, you want to go next slide, please? The next couple of slides, you'll see just different samples of what we've been doing. When we talk about community education, we have done conferences, harm reduction, facing fentanyl head on, which obviously is one of the most dangerous synthetic opioids. Has caused so many deaths in the state, in the country, in the county. these last few months, couple of years. Next slide, please. Thanks. We also have, again, community awareness messaging. Xylazine now is a big thing. We put these signs around the county. The other messages that we have all over. We've done everything from placemat ads in diners to billboards to we're laughing. Patrice was laughing at me because now I've started using shopping carts and ShopRites and putting, when you're pushing and you see those little messages there, we put that last message is all over the county now. We will on October 6th have Knock Out Opioid Abuse Day awareness and messages on this again on our Facebook, of course, our Facebook ads, our website. We will do the shopping carts again. We will be on the CNN website and the New York Times website. Just spreading the word, making people aware of what's gone on for years now with opioid use. Next slide, please. Oh, these are just more of our mini ads that I love. And these, again, we have all over the county, of everything that we can use to educate and, again, let people know about the dangers of opioid use. One last quote from Painkiller: "We must convey the humanity of the individual and reject the stigma." And these are the messages that we have to keep getting out there. I appreciate Knock Out Opioid Abuse Day so much because it allows me to be out there more. So thank you for all of you for being here, and hopefully you will help us out on October 6th.
Thanks so much. And you guys had some great ideas. I know we had some questions in the chat specifically
We're going to
related.
turn our camera off, Angela, just so we don't lose
Turning
stability.
camera.
Yeah.
Okay.
Might help.
Okay, hopefully it helps. Specifically related to your presentation, I know I'll start with that. Patrice, you spoke a bit about some parent education outreach that you do. And just wondering some of perhaps the strategies that you use, to engage parents, particularly around this topic and around Knockout Day.
Yeah, so some of the well, I'm not sure about so much strategies, Angela, but what we do is when any program that we're doing, and we're actually doing a ton of back to school night programs this September, and we're doing our hidden in plain sight where we mock a teenage bedroom, and a lot of the conversation does come up about opioids and fentanyl, and so then we of course will talk about Knock Out Opioid Abuse Day and the importance of it and how they can again help in their communities. So it's really great. And another unbelievable, which is probably my first year this past year with our older adult program, how they're really asking for the information and how they can help and what they can do in their communities as well. So we're, empowering people in the community to go out and help with Knock Out Opioid Abuse Day, not just our own staff. So it really is great. It's getting larger and larger in quantity. So.
And I will say,
So
I'm
great.
sorry, Ange.
Go ahead, Barbara, go ahead.
But I will say too, even our, what has been mostly webinars these last couple of years, our conferences, trainings for community, including parents. And I showed on one slide what we had done about fentanyl, and was so well received. And, you think more people are aware and know, but really not. I mean, after the feedback that I got after this conference was incredible, how surprised people were. And now, of course, with Xylazine, we're getting out there about that. If anyone would want more information about these conferences, please let Angela know or me at Prevention is Key. We certainly would love to bring them to anyone who needs them.
No, thanks for that. And as like I mentioned in the beginning, we are holding steady in the state, but our numbers are still terribly high. And so reducing that stigma, like you're talking about, Barbara, looking at the different ways it's manifesting itself And, we've been talking about this crisis all the way from the beginning 12 years ago, right? Safe disposal, and just seeing the way that it's continued to evolve and the different strategies that we've, responded with. And so, Rebecca, I have a question for you. I want to make sure you're with us.
Sure.
Yes. Okay, great. So I know you mentioned one of the counties that is doing some great work, but can you talk about some of the other strategies that you would recommend for groups and alliances who may be on with us?
Absolutely. I think that one of the things that is probably the easiest way to get information out is to start talking about this at your monthly alliance meetings. If you don't have monthly alliance meetings, reaching out to your members within your alliance because of the relationships that they carry within the community, starting off there is a great opportunity. Just talking about the event, getting them to understand what it is, what it's designed to do, and also have everybody save the date for October 6th as the outreach date is important. And then I think it's important to brainstorm ways to reach out into different sectors. So one of the things that I've always stressed and continue to stress is to make sure that we are staying culturally relevant within our communities. So having adequate representation from the community and the population and portion of the community, making sure the demographic is represented, having those conversations within that community to find out what's the best way to reach that community. And then talking to them to see how do we best do that. In some cases, it's going to be going through churches. In some cases, it's going to be providing handout information, visuals that have been translated into different languages for our non-English speaking populations. Also just looking at how do we best reach. So those things I think are vital and important in the planning because that will really get you to the implementation. So once you have an idea of what that community needs, it's really getting them involved and getting their buy-in to then go out and spread that message into that portion of the population. So it's very, very important, I think, for a number of reasons to make sure that we are being culturally relevant here in our approach to all of this, especially because there's a lot of stigma that's carried throughout communities. And so when we talk about really reducing stigma and completely, certainly it remains a barrier and we work diligently to change that, understanding that piece and understanding where that lies within the community. And so I think that that's also a really good piece to understanding the community and knowing better where and how to reach out. So once you have those things, I think it really takes a very individualized approach into getting into those communities. But having those conversations first, I think is the starting point for moving forward.
Thanks. And I know there are a lot of resources that are available for communities. We talked a lot. I know Matt showed the examples of some paper resources that we have available, but we also have digital resources that are available. And I know Matt touched on those, but Matt, can you talk a little bit about how people can access the hard copies, right, of resources or get materials like that? And also the benefit of sharing messages or sharing press releases. I know you touched on it, but could you expand on that?
Sure. So first, if you have an interest in any of the physical materials, you can email me, and I'll actually just drop it in the chat. It's matt@drugfreenj.org. I will put that in there in a moment. But we do have, Rebecca makes a really great point about representation. We do have quite a few different types of physical, like I said, physical materials, some in Spanish as well, which, so if that's a need for you, please just email me and we can set up a time to get those for you. And then the second question, Angela, just sharing the messages. I think it's just visibility is such a key, part of what we're doing here with the campaign. And trying to, I think Rebecca had said this before when she was speaking just about sort of casting a wide net as an approach and getting so many different elements of a community together on this really important issue. So to have sending these messages posting on social media, sending the emails, handing them out in person, you reach a lot of different people. You get different people within the community, hopefully energized and involved in trying to, do the same on their own or as part of your efforts. And the more you get, the more visibility it has within the the community, within the town. What we're trying to accomplish here is just much more possible through those efforts.
Yeah, and I know, Rebecca, you mentioned the faith community, and I know we have members of the faith community who are on with us today. I recognize them. I know some have said hello in the chat. I know we've had some success with that. Matt, I know we've had the partnership has had some success with that. I know there's been some great strategies that were used, like inserting in newsletters and bulletins and some signage around churches and other types of religious institutions. But and Barbara and Patrice, not sure if you guys have had any success stories with the faith community, but just anything we can add to that, whether it be something that is a resource that we give you and you insert, like we said, whether it's a poster that you can use to hang up. Right, Matt, we have some materials that we can provide that way. We also have, I believe, Matt, are there any other resources for the faith community in the toolkit?
Sure. I think both physical and in toolkit there are some as well. It's just as far as basic information, handout size things. The posters you mentioned are also a good one. Yeah, and I think if there anybody has, like I sort of alluded to in the beginning, if anybody has any ideas or certain things you're looking for, you can also email me, which again I have to put that in the chat. I forgot to do that a second ago. And we might have it, if there's something specific you're looking for, we might already have it, or we can, adjust something we already have. So, but yeah, we have definitely a few things that would be useful in including within, within the faith community's efforts on this.
Right. I said, Ange and Matt, before, what we've loved is the sample sermon that you have in your toolkit, because again, many of the churches that we've gone to have used it, and some have taken bits of it and put in their bulletins. I mean, there's tremendous resources there. So I want to thank you, because that's a really big population hit, because they reach so many people too. I want to talk a minute about Sigma. We've all talked about that, of course. We have been working to make people aware of, what is our thing called, first person, I can't remember what we're calling it, but we have a couple of young people that had become addicted to heroin because of prescription painkillers. One young man in particular that was very close to me died last July. And he was a football player, he had a full scholarship to Villanova, the whole thing, and then became addicted to the pills and went on to heroin and died last year. So we have started a campaign to show this young man through the years, and only mentioning at the very end all that was taken from him because of RX drugs, heroin, and all that stuff. And we've put that on our website, and we're trying to include that in as many stories as we can. So if anybody wanted to talk about that too, we can give you access to that and possibly use it in your communities too. It's a beautiful, we have pictures and stories, and his mom and his grandma, and it's just beautiful, and it breaks your heart to see that all of it was taken from him at such a very young age. I think
No, Barbara, we're all so sorry about that loss. I know that family was so involved in trying to get the message out as well. And we also, it's so important to share stories, right? And the stories that you're talking about. And that's for all of you who are on as well. If you think that that's something that can make an impact in your community. Because sometimes you really
Mhm.
need to put a face to the issue.
Right.
You know, Barbara and I were having a conversation the other day, and we were talking about the new the book Demon Copperfield, that's out, and how so many people are reading it and saying, "Oh, I finally see a face to this issue, and it makes me see it in
Mhm.
such a different way." And so, you know, as we look at sharing stories, we have a section on our website where there are stories of people from all over the state, right, who are sharing their different ways that the opioid crisis has impacted them. And so, you know, I invite you to share those within your community. We have videos that you can share, learning series, you know, topics that you think might resonate in your community. You can share that link, you know, leading up to October 6th or on October 6th. And these things will have a significant impact, right? We can share simple messages, or, you know, we can share these videos. Matt, we had a question that came in from a school nurse saying, how can a school get involved? Can you touch on that? And then Rebecca and Barbara and Patrice, if you have anything you want to add.
Sure. Yeah. So a lot of ways. We've had students really involved in a number of ways over the years, and I actually should have mentioned this before, but we have, you know, if there's a need for you know, service projects or service hours, things like that, we will, you know, sign off on that with, you know, the right information stuff. But you know, we've provided materials, and they've distributed them throughout the communities in some cases with help from some of their you know, advisors and leaders of certain groups. Number of them over the years have, you know, this combines kind of two things I spoke about. They've set up tables at the football, you know, the Friday night football games or other events, and have, you know, not only provided the materials, but have been able to sort of speak with people about it too, which is a great thing. There's been, you know, other ways, just sharing it through social media. We've had some schools in the past, I think, and forgive me for, I can't remember the name of the school. I know it was down in Cape May County, where they actually had students who took that sample resolution I made before and went to a council meeting or township committee meeting, one of whatever it was, and you know, they voted it on it and approved it while the students were there and spoke before that. So that was really, you know, not only great for what we're trying to establish, but a real good lesson in sort of civics, really. So that's a few different ways, but we're always, like I said, there's always, you know, new ideas every year, and if students have, you know, ways that they think they can really do it in their own way or something new, you know, we'd be happy to, you know, hear those as well, and they're always open to that, and you know, always encourage creativity on that. But those are just some of the ways in the past where they've you know, made their mark in on Knock Out Opioid Abuse Day.
Matt, I just want to add one thing that I think was very cool, what the Morris County kids had done. A couple of the schools had asked students to talk about opioid use, Knock Out Opioid Abuse Day, on their PSA, you know, the announcements in the morning. And that went over really well. The kids loved doing that, and it did get word out to a lot of them. We also we worked with schools. Some of the schools put our messages out on their you know, when you walk in and there's a digital board, or some have TV screens, put it on October 6th. They had done that, well, actually that whole week and some of the month, but that was done last year, and again we'll do it. But kids liked to get involved in it, to be part of it, so that was really good.
No, thanks for adding that, Barbara. I know we had some interest from Scouts and have done stuff in Scouts. I know Community in Crisis organized some Girl Scouts a few years ago. But Rebecca, was there anything that you wanted to add on ways students
Yeah.
can participate?
I think our young people are our most underutilized, untapped potential for sharing this message. And I think there's so many ways to do that and to engage them in the process. Most schools have different various groups, peer groups, and mentoring type groups, scouts, all of these after school activities. So it's, obviously, like we often do reach out to coaches and sports teams. That seems to be, a big piece of the involvement with the schools and understanding, opioid misuse, particularly around sports injuries. But I think we often leave out the other groups that are doing tremendous things in reaching the student population. So looking at those other groups in the schools, talking to the teachers and advisors, and being able to share the information. And again, going back to what I said before, making sure that they are involved in the planning, because they know how to best reach their peers. That's the one thing that we tend to do as adults, is we love to plan for and how to implement prevention with our young people without involving them in the process. And so I think that has to happen in order for this to be effective. And I think there's some really easy and great ways to engage our youth. And I have seen some tremendous things come out of that when the youth have been empowered and really are able to speak that message further. So it's a wonderful thing to see that play out. So you have a great method of getting the information out.
Absolutely. And I think in the past, not only have they engaged with their peers, and obviously, as we talk about social media, we have a youth athlete video that can be shared on social media. And when we talk about different ways of getting messaging out to youth, obviously peer-to-peer messaging is so important with that, right? When we're coming in as adults saying that. But also we had some great groups of teens, I think from like Wall Township comes to mind, that went to their local grocery store and bagged as a fundraiser, but also then put materials in the bags, which was Knockout Day materials, information, and they were able to get service hours for that, for any projects that we needed. So we're happy to work with any schools, any students who reach out to us if they have a plan, if they're looking for, whether it be Key Club or National Honor Society or just a service requirement, happy to work with the students. And then I know we also had a question about just how doctors' offices can get involved. And I know that, we talked and Barb touched on the idea that we have prescriber education, and we're going to be announcing and unveiling new prescriber education to correspond with this year's Knockout Opioid Abuse Day. But Matt, can you talk a little bit about ways that we can, work within those offices, maybe messages for patients that can be left out and different things in waiting rooms? Can you talk a little bit about that?
Sure. Yeah, that's been done. We've had that success with that in past years. We do have prescriber guides that are available, physical copies. We also have the PDF of it that can be shared that way, which have the latest guidelines from the CDC on proper prescribing of opioids. So those are over the years, we've had volunteers or participants bring those to doctors' offices and just kind of drop them by, and they've used them or given them, shown them to patients or consulted them even. So those are a really, really good resource to, for really anybody. If you have, there's really quite a lot of information in there, but we've done that in past years as a way to educate both the prescribers and the patients as well.
Right. And Barbara, I know you did some outreach as well with different offices, and I know particularly with the hospital system in your community, able to get some messaging in patients' rooms and in other things.
Yes.
Can you talk a little bit about that?
Yeah, Atlantic Health had really worked with us and put on the TVs in the patient's room messages that we had given to them.
Oh, Barbara, I think we lost you again.
Here I am.
Oh, you're back.
Got me?
Okay.
Yeah. I think it's this room, guys. So
No
I'm so
worries.
sorry. We even changed rooms trying to make it better. But anyway, what we're thinking for this year is to offer, they're called video cards. We had done this with our ACEs campaign. It is a beautiful book that we had put on the tables in waiting rooms. So instead of magazines, the people waiting looked at this information, and it had all been about adverse childhood experiences. But now we're thinking of doing it about opioids, fentanyl, synthetic and prescription pills. We had tremendous luck with that, so we're hoping to do that again. If anybody wants some information about that, I can certainly tell you. They're beautiful digital books that one of the staff had talked into it, and pictures. It was great. It was great. So
Thanks.
that's
No,
what we'll do this year.
thanks, Barbara, for sharing that. And hopefully we can maybe put that in the toolkit as well.
Definitely.
So everyone can access it. And we have other, like I said, there's materials that you can print or share yourself, or you can contact us. Matt put his contact information in the chat, and we'll follow up in an email with that. If there's any other resources that we can provide you without cost. So happy to do that. And also to work with you if you have messages, or you have an opportunity or a place to get a message out for Knock Out Opioid Abuse Day or around that time. Happy to work with you on that. And then we'll also be getting out messages in your community through some pharmacy bags that'll be going out. So we'll there'll be some statewide efforts that are going in as well. And we're really looking forward to seeing what how we can help you, and the messages that you can get out in your community to help make a difference. I know we're running out of time. We have about a minute left. So I just want to go to a final question for all of our panelists. So as we look at some of the best strategies and how can we really be impactful? And Rebecca, I'm going to start with you. And if you could just touch on, as we look at all the different parts of the state, right? Because we have representation on from Salem County, and we have representation on from Sussex County, right? And all in between. So can you talk a little bit about how those strategies should be individualized, but, briefly?
Yeah. So quickly, again, just really making sure that you're reaching out to your community members to know what's needed in your community. I think that communication and looking at people and what their sphere of influence is. So making sure that your stakeholders are involved in the process, that's going to be key in getting the information out. And again, thank you, Angela.
Thanks, Rebecca. And Barb and Patrice, I'll go to you next.
Yeah, hi. I want to ditto Rebecca. I mean, knowing what the needs are in your community. When we talk to a lot of the school personnel, mostly, they had said that parents had to be made more aware of, particularly the pills given to young athletes, and that parents were sometimes the ones pushing for the kids to get meds because they wanted them to excel for scholarships. So again, it's awareness, it's education to the parents. So that's a big priority in Morris County.
Yeah, and really across the state, it's a great strategy, Barb, that will work for anyone who wants to implement that. And Matt, I'll leave you with the last comment.
Great. Thanks, Angela. Yeah, I would just say one thing to think of. There's nothing really that's too small or that would you say is insignificant in any sort of effort you do, whether it's an email here or there, just talking to your friends or family and saying, hey, just be aware of this. I think that's part of what we're trying to do here is just establish the routine discussions and make this part of everyday life. And I would just say for those of you that do use sort of a virtual platform or are really into social media, I think it's always good to share that as well, just to as sort of to spread it in that way. So those are two things that I would say are really great and really important in as a key part of Knock Out Opioid Abuse Day.
No, absolutely, man. I think that really summarizes, right, what we're talking about today. We all have a role, whether it be big or small. We all can do something to help educate, to help prevent, to help reduce stigma, and ultimately help to save lives. And going back to the original quote that Barbara shared from Painkiller, right? Because we know it's not just impacting that one person we're trying to save, we're also trying to save the family and the community. And so we're here at the Partnership for a Drug Free New Jersey to provide any support if you have, as Matt said, any opportunity to share something, or you have an idea, or you know, see any, you have a way to get some information out, please, any assistance we can provide, please do not hesitate to contact us. We're putting all of the information in the chat. We'll follow up. We'll continue to send you guys updates as between now and October 6th with information on different things that you can share via email, on social media, and other opportunities to participate. But I want to once again thank all of our panelists for being with us today. I appreciate all of the knowledge and insight and experience that you shared. So thank you for your time today. And I want to thank especially all of you who have joined us. I look forward to working with each of you, to continue working with so many of you who have joined us again for maybe the 8th year, but also to work with many of you who are on for the first time and joining this effort for the first time. So thank you so much. And I wish everyone a good day. Be well, everyone.